Hello, my name is Dr. Elizabeth Miller. I'm a naturopathic doctor here at Sequence Wellness, and I'm going to tell you a little bit about my story as to why I became a naturopathic doctor and what it's like to work with me. So I knew I was going to be a naturopath since the age of 16. It was just always the trajectory that I wanted my career to go ever since working with a naturopath. So when I was a teenager, I was dealing with a lot of chronic gut issues, digestion problems, and a naturopath was really who helped change my quality of life. I wasn't feeling heard by the conventional system, and working with a naturopath was the first time that I really felt heard. Somebody who dived into more than just my symptoms, really dove into my nutrition, my stress levels, things like that. And so she really inspired me and has shaped to my whole career at this point. So I'm forever grateful for her. I devoted my undergrad and master's to nutrition science. I did my master's thesis studying IBS research as well. So it was an area that was very important to me, and I knew that nutrition would be an area that I would integrate a lot into my practice. And nowadays I use it all the time. I find that nutrition is an area that is underutilized a lot in medicine and can make such a difference, especially for chronic health issues. I find naturopaths are really great at working with patients who've been dealing with a lot of chronic health problems, whether that's metabolic, like diabetes, metabolic dysfunction and weight gain, or resistant weight loss. I work with a lot of patients for hormonal imbalances, whether that's PCOS, endometriosis, whether that's also for the transitional periods of perimenopause and menopause and postmenopausal times as well. Naturopaths in Ontario, some of us are able to prescribe hormone therapy, so bioidentical therapy, so I do that with some of my patients as well. And I really am passionate about understanding the inside with my patients. So I do a lot of lab work. I find that that can also be so helpful at targeting a very specific treatment and giving people really individualized care. So usually a first visit with me, it's really long. It's 90 minutes. We go through somebody's whole body health just so that we can get a good understanding of all the organ systems, because everything is integrated in some way, including stress, right? Our stress levels and our nervous system really manifest on a physical level in many ways, and that's how a lot of chronic illness can develop too. So I talk a lot about that with my patients, dive a lot into their nutrition, and I help them wherever they're willing to start, right? Not everybody wants full interventions and changes to their diet, and other people do. So I can help patients wherever they're ready to start with that. My philosophy is trying to use as minimal supplements with as much as we can get through the diet, but that's not always feasible depending on the therapeutic dose of things. So sometimes supplements are necessary. I really like to use herbal medicine, especially for hormones. I find that that can make a world of difference for women's hormones. So, tinctures, herbal supplements, things like that I often utilize. So kind of, it really depends on the person and the way that a visit will go. It's not one size fits all, but that's why I love it, right? It's so individualized, and very specific to the person. The other thing too is a lot of lab work is expensive, so I like to keep that in mind. I always keep cost a factor with my patients. If they have benefits that will cover their labs, then let's run as much as we can and get as much data as possible. But other times that's not always feasible, and so I always meet my patients where they're financially open to working with. And there's lots we can do even if we don't do testing. So that's kind of in a nutshell what it's like to work with me. I see patients for a wide variety of different conditions, like I said, digestion, hormonal, chronic fatigue. I see a lot of women for chronic HPV infections, women and men who are dealing with that. And I can help patients with helping clear the virus while they work alongside their gynecologist for the abnormal cells. I see a lot of patients as well for thyroid dysfunction, autoimmunity. I'm seeing a lot more people lately with MCAS dysautonomia, so that's an area that I'm doing more and more research in as the research evolves. I see a lot of pediatrics as well, ADHD, helping with childhood anxiety, digestion problems in kids. That's an area that I love to work in. I did my 4th year residency in pediatrics, so that's something that I still integrate today as well. So that's kind of in a nutshell what it's like to work with me. I really like to prioritize listening and hearing my patients. What people are going through on a physical level is more than anything that a doctor can really understand in just, a short visit, right? So allowing the space for people to share their story and keep an open mind. I have learned that open-mindedness is so important in medicine, and something that we don't experience enough of nowadays. So I work alongside people's medical doctors as well, and can work more in an integrated setting. Referring patients back and forth can be helpful to other practitioners like physiotherapists, osteopaths, pelvic physios, therapy. I like to work alongside other clinicians as well to give patients that optimal care.